Lake County is an absolutely wonderful place. We have these magical downtowns.
You might pass a mom and pop store. You can look out the front of the library and just about see Lake Michigan.
We have such a diverse community. People of all races and ethnicities, all gender identities.
There's a broad base of people that have, and then there's a broad base of people that are in need. And as we saw the effects of COVID-19, the needs became even more apparent.
2019 versus 2020 is night and day. It feels like a war zone.
For every one Caucasian person that had COVID-19 here in Lake County, there were 5 African Americans and 9 Latinos.
We immediately formed these 2 community partnership groups to reduce the disparity, and that really all comes down to what we call equity. Each of those communities needs something slightly different to get the healthcare that they need, and now to be vaccinated for COVID-19. Once we had the policy and the procedure in place, we then built the technology around it to support that, and that is what AllVax is.
AllVax had to be a great tracking tool on how many vaccines we've given out, how many of which vaccine to get in for second doses.
When it comes to vaccine orchestration, having a single source of truth is the most important thing. The CDC changes their information almost daily now. Our system has to be able to respond to that. Our system can talk to other hospitals, to pharmacies, to businesses and their HR systems. And so we're able to get this 360-degree view of our community members.
Were they a first responder? Were they a factory worker? Were they a school teacher? Because that was going to put them into a priority list. We had zip codes that were very hard hit. We want to get those people vaccinated first.
The Salesforce platform allows us to do that in a way that is seamless to our community members.
All these people were helped. It doesn't get any better than that. Doors are open, people are collaborating, sharing data and information. They're going deep into communities to support people where they are.
Which is an amazing thing, because that allows us to make sure that everyone who wants to get a vaccine in Lake County can get a vaccine in Lake County.
To be part of this response is such a privilege. You know that for every second shot we're giving, that's somebody less likely to get this, pass it on, and possibly lose a life over this. It's a happy day every time we come to this site to distribute vaccines.
We have been able to create transformational change within our community, and having families see the Lake County Health Department is our ally. And what they're offering in this AllVax is a trusted source. It's not the government and us. It's us as a community. We're going to make it. We're going to be okay.
Hello and good morning. My name is Paula Goldman. I am Chief Ethical and Humane Use Officer at Salesforce, and I'm so pleased to be the moderator for this morning's Commonwealth Club program on vaccine equity. And Salesforce is proud to be the underwriter for this program, making this content accessible to broader audiences. The video you just saw was about Salesforce's work in Lake County, Illinois, on this extremely important issue, ensuring that all communities, particularly our Black, Latino, and Native American communities, have access to the COVID-19 vaccines. One important thing we have learned throughout the last year is that COVID-19 has impacted some communities disproportionately. Quite simply, some communities, because of how and where its residents work and how their families live, have been hit harder than other communities. And the reality is that the pandemic shined a spotlight on and deepened health inequities that were already part of our society prior to the health crisis. Now, thanks to the nationwide rollout of vaccines, we are starting to see the light at the end of a very long tunnel. Yet vaccine equity will very much determine how quickly our society can return to normal, and is an issue of the highest importance to our country and its people. As Chief Ethical and Humane Use Officer at Salesforce, I've been working closely with our teams from very early on in the pandemic on how we can support our communities through both giving back and through technology solutions. We're a proud funder and technology partner of Gavi, the public-private partnership behind COVAX, as it works to equitably distribute approximately 2 billion vaccines to 190 counties by the end of the year. And as vaccines move through priority groups, we've joined the Vaccine Prudential Initiative and the ID 2020 Good Health Pass Collaborative to ensure that people can maintain health records and demonstrate health status while protecting privacy and ensuring control over personal data. Now, no one knows the importance of equitable vaccine distribution better than my guest today, Dr. Kirsten Bibbins-Domingo. Dr. Bibbins-Domingo is professor and chair of the Department of Epidemiology and Biostatistics at UCSF. She's also the inaugural Vice Dean for Population Health and Health Equity at the UCSF School of Medicine. Since the very start of the pandemic, Dr. Bibbins-Domingo has helped lead UCSF's effort to address the unequal impact of the pandemic, particularly in the Bay Area's Latino communities. She and her colleagues' community-based efforts on this issue have served as a national model, and I'm so pleased that she has joined us here today to discuss vaccine equity. Before we jump into the conversation with Dr. Bibbins-Domingo, a quick note. If you have a question for either of us, please post it in the YouTube chat box. Questions will be forwarded to me throughout the program, and I will get to them. I will get to as many of them as possible. So without further ado, let's jump in. Dr. Bibbins-Domingo, thank you for joining us today.
Thanks so much. Thanks for sponsoring this conversation.
And I love the green coat for St. Patrick's Day. Well done. Let's dive in. So first of all, tell me a little bit more about your role at UCSF and how you've been supporting vaccine distribution in the Bay Area.
Sure. So even before the pandemic, and one of the things, health equity has been so deeply rooted in the work that we do at UCSF. I was offered this position to develop a vice dean role for population health and health equity 3 years ago. And not because we weren't doing health equity, but because we were doing so much and to figure out the infrastructure that allows us to do this better. And then the pandemic hit, and the pandemic for all of us who were working in health equity, we knew we would approach it from that lens. And it became very clear just a month in that really equity was not going to be the story on the side. It was going to be the front and center major story. And my good fortune is to work with really outstanding colleagues who really moved quickly and moved with their partnerships that they already had in the communities to try to think about how we make sure that testing is accessible, that information is accessible, that people knew how to respond in the ways that were going to be important for the pandemic. And that was primarily in San Francisco and Alameda, and focused on the Latino communities because they were so disproportionately affected in large numbers, but also on the unhoused populations, on African-American populations, and on thinking about how we educate all of our lower income communities on the important things they need to know during the pandemic.
So before we dive into vaccines specifically, I think it's really important that we paint a picture of both what the pandemic further shined a spotlight on in terms of inequalities, but also how it exacerbated them. And I know that kind of the early days of the pandemic, there was a lot of uncertainty and a lot of confusion about what the status on the ground was. But you were amongst the first to see very clearly that this was not hitting all communities equally. Just paint a picture of that kind of that early phase and how you saw that so starkly early on.
Sure. So we're at the 1 year anniversary, and I remember of the lockdown in the Bay Area, and I remember thinking, I'm not an infectious disease doctor, I'm not an infectious disease epidemiologist. What I'm going to focus on is how we can provide care, and we needed many people to be on the front lines to provide care because we didn't know. I provide care at San Francisco General Hospital, and what was crystal clear to us very quickly was that virtually all of the patients we see at San Francisco General Hospital who had COVID-19 in those early days were Latino. Latinos make up about 15% of the population in San Francisco. We care for a greater proportion amongst our patients at San Francisco General, but certainly not to explain the fact that 80% of the patients in the ICU were Latino. And so it was pretty clear to us that something was going on differently. We started to get information from New York City talking about both Black and Latino disparities that they were seeing there. And I think that all came together for us to say, oh, this is going to play itself out differently. All of our lives are affected because we're locked down, we're shut down, we're worried about infection. But it was pretty clear that some communities were going from being more than worried, but knowing people who were in the hospital, knowing people who had died, and that we were going to have to respond in a very different way. When I started learning more about pandemics, this is in some ways, unfortunately, what you expect in a pandemic is that the people who have less resources, the people who have less access to knowledge, less access to information, less access to financial resources, to shelter, who have to be out on the front lines working, those are the people who are always going to be in the front lines during an infectious disease crisis like this is. And I think that's what made us want to say this time was going to be different. We were going to have to think differently and mobilize differently. And fortunately, because we had been working in the communities, we were able to do that in partnership with our community partners and departments of public health and many others who really saw the need and tried to meet the moment.
It's so striking and so sobering, those just you're relaying those early experiences and how those inequities continued throughout the pandemic, including with the vaccine rollout. So Governor Newsom recently promised that around 40% of vaccines would be for vulnerable communities, but we know that the actual work of getting shots in arms can be challenging. Talk to me about that. How do we make this happen? What's working so far and what needs to change?
Right. So we're all fortunate because we have these fantastic gifts of these vaccines. But the hard work was making the vaccines, but then getting them into where they could actually protect people from the coronavirus. I think early on the narrative developed that African American communities, Latino communities, other communities who might have less trust in the healthcare system, for whom the healthcare system is a daunting process and not one that is trustworthy, that they would be more hesitant to get the vaccine. And I think that narrative sort of stuck in very deeply. And I ignored the fact that really what we need to do is make access available, make vaccines available to all communities, make sure that all communities have information, and that the hesitancy is always something we have to address in a particular segment. But more important for the communities we're trying to reach is really about access. And luckily, I think that story, that narrative has shifted. I think California has done a fantastic job in highlighting this issue and saying that, yes, we have to prioritize older people in California because age is the predominant risk factor for having a severe outcome from COVID-19. But also, when you look at the map of the cases in California, you know that it's quite uneven which communities have been affected. And so we have to go to the place where the virus is, not both because it is critical in our social responsibility to make sure we protect the most vulnerable across all vulnerabilities, but also if we're really going to get to the point where we have the virus under control, we can't ignore the fact that the virus has been sitting in certain communities much more than others. And so it is both an equity strategy, but also an effectiveness strategy. Relates to how effective our vaccination campaigns are actually going to be.
Yeah, so just in that one answer, you touched on a number of common misperceptions, one about vaccine hesitancy, one on a trade-off between equity and efficiency. So that's another narrative I hear very frequently, right? That there may be some tension between how narrowly or widely you set these criteria for who gets vaccines when versus just rolling them out to as many people as possible. And what I think I just heard you say is that it's not an either or around equity or efficiency. Would you agree with that overall?
Yes, I think that's exactly right. I think, early on, we were coming out of the winter surge. We had these vaccines. We wanted to distribute them as fast as possible. And that is exactly the goal. And you saw that in the mass vaccination sites that we have in California, we have across the country. And the idea is that just the volume of people that we want to move through. And I agree with that strategy. What I don't agree with is the idea that we somehow have to sacrifice equity for efficiency, that it is only mass vaccination sites, and that later on we'll try to figure out how to get to some communities that might not have transportation to get there, or might have harder times navigating the digital appointment systems. I actually think that ultimately what we want is an effective campaign, and an effective campaign has to link efficiency and equity, because equity is both, again, our moral responsibility, our societal responsibility, but also relates to really where the virus actually is right now in California and where it has sat for so long in this past year. So I think these aren't trade-offs. It's a both and. We need the mass vaccination sites, and we need to figure out how we can get people to the mass vaccination sites. We need the efficient technology platforms that you've highlighted so fantastically, and I know Salesforce has contributed to in a really major way. And we need to make sure that we can engage with community members so that they can actually use those technologies to make them most available to community members. And I think these are collaborative strategies. They require working with community partners. And I think that's how we can achieve both to make effective vaccination campaigns.
Very, very well said. And I appreciate you bringing up the question of access to technology. It's obviously something I spend a lot of time thinking about. So I know, for example, that when we design our own COVID solutions at Salesforce, we think a lot about how to make sure that they're inclusive. And not only just how do we protect sensitive data, but also making sure that, you don't necessarily need a smartphone to register, or that we're creating clear consent around what data is being stored, that the data intake is very sensitive to categories around gender and race and what people might want to disclose and how. What else should we be thinking about, either in terms of technology or in terms of other obstacles, as we think about reaching everyone in their communities? How do we cater the approach to making sure that we're marrying these twin goals of equity and efficiency, in fact, that feed into each other?
Yeah, I think you've highlighted some really major ones. I think just making it as easy as possible to use, and recognizing that people have been fearful about how their data is being stored, what types of identities they want to reveal, that from a public health perspective is so important for helping us track a pandemic, but from an individual's perspective might feed into that sense that, well, how is this data being used, and why is this important for me to get my vaccine? I think that some of the issues relate to certainly in California and across the country, relate to language access and making sure that these types of platforms are available in all language and at the lowest literacy level. I like that people point out that literacy levels are, that many people have lower literacy. It turns out that all of us react better to technology and to anything that is in a lower literate level, because it's just easier to understand, and it's the bandwidth to try to do many things, and then if something is easy to be able to use, it's easy for all of us, even if we don't have lower literacy levels. I think one of the things that we've been very interested in doing is, in many of the communities we're talking about, there's a generational gap, and younger people oftentimes are much more savvy with technology. And one of the things that we have been utilizing at many of our testing sites that have turned into vaccination sites is using vaccine ambassadors, mostly young people, both to help get the messaging out, but also to help with some of the registration. Because even for an older person, technology solutions can still be daunting, even if they're easy to use. But if they are easy to use, then it's usually somebody that somebody else within a household, within an organization, can help to really make that platform accessible to them. And so I think that you've hit on all of the strategies. I think the reality of the digital divide means that we have to put these strategies in the hands of our community partners, of those who can get the word out to all corners of our cities and our counties to be able to use these most effectively.
It's so important what you're talking about. You keep coming back to the importance of communities in the rollout, right? So it's not just the science; it's social capital, and it's making sure that the right people, the right connections, and the right communities are activated. I am seeing why your work is a national model and why it is so deeply important. I want to turn to a question from the audience. And the question essentially is asking, has the acceptance or the desire to receive the vaccine, has it changed amongst different groups over time as the vaccine has rolled out? Do you see it as being roughly equal now amongst different groups, or are there still disparities around that? And I would even ask, because you sort of hinted earlier about this narrative about caution around the vaccine being perhaps the wrong narrative, like, is this the right question to ask? How do you respond to this question?
Yeah, super great question. So if you look at the earliest data that came out and has come out over the last many weeks, we did see these gaps. The national data is usually around African Americans, showing lower rates of vaccination within categories of people who were prioritized, so older adults or healthcare workers or first responders. And the narrative that emerged after that was, well, that's likely hesitancy, and so we have to go and do this. I think what's happened since then is people realize that a lot of this is about access. And so if you look at the latest polling data from Kaiser that has really been tracking this, that there is no gap in willingness to accept the vaccine if offered in African Americans, in Latinos. The biggest gap they see is actually in rural communities, and I think that is a community that we probably have to reach. There's some relationship with political affiliation that's sort of interesting, and it does speak to the different narratives that have emerged around the vaccine. But I think so. I don't mean to dismiss it entirely. I mean to say that what we had, the narrative that had played out early, that racial and ethnic disparities were about hesitancy, has both proven not to be the case in the polling. And I think we've been able to close those gaps. San Francisco doesn't actually have a gap, but we've been able to close those gaps, I think, because of these strategies. We have to use the data. We have to monitor. We have to always see what more we could be doing. I don't mean to be complacent on these issues, but I think it does suggest that when we engage communities, when we get the word out, there isn't some ingrained hesitancy that will prevent us from really allowing these great miracles of the vaccines to really be able to help all communities.
Got it. Okay. So that very well said. Also, speaking of the audience, I know many members of this audience are working to play some part in the vaccine process, whether maybe they work in the healthcare system, maybe they're part of a company that's powering some part of the process. What are the things we should all keep in mind about how we contribute and how we can do this work together?
Yeah, I think that I do think that the pandemic has taught us how interconnected we all are, and I think we I would love that spirit of that interconnectedness to keep forward. We will have a time when some of us are vaccinated and some of us are not. I think we have to think about how we message the positive hope that we will get to the point where we can really truly open up our cities, our counties, and to do that. I think there will be people who are not against the vaccine, but want more questions answered. And I do think all of us play a role in being positive, messaging in positive ways, and answering the questions. Having questions about the vaccine is a reasonable thing to do. Everyone should do that. We see in Europe right now this massive response to a concern about a particular side effect that they're seeing in Europe. It's important that we address questions. That is about being responsible consumers of healthcare as citizens and as residents in California. It is, that we don't demonize either a particular group because we're concerned that they're not getting the vaccine, or the right for people to ask questions. We've seen too much polarization in this pandemic, continue to see polarization playing out right now. And I think the responsibility for all of us is to think with our equity lens, to think as a collective whole and what we can do to get our community to move forward in a healthy way. And I think meeting people where they are with regards to the vaccination is going to be important at this time. And all of us play a role in doing that.
That's fair. What are some of the local organizations getting vaccines out in our community? So, for example, if audience members wanted to support some of those organizations philanthropically or as a volunteer or whatnot.
Yeah, so I think that if you look at that the organizations that serve the particular communities that we are talking about, we work with Unidas en Salud is the coalition that has developed around Latino health in San Francisco with the Latino task force. They have been working both to get the word out and to educate. Umoja Health has been working in the East Bay and we have been part of that coalition as well. There's a coalition that's been working around homeless, unhoused populations. I think those are probably the three main focal points as we've come to do that. And some of that starts with the community groups like Latino Task Force, like the faith-based organizations. I think if you look at the populations, we all know now the groups that are at risk. I think the organizations that have been working with those groups over time are probably your best source of contact for who's helping to vaccinate in these groups and how can I support that. They generally know everyone has an interest in a particular group or a particular neighborhood. I think that's what you can do. I think if getting the word out, I think there are organizations who are helping on the communications front and to do that. And then I think that there are ways in which other people who might have things that they want to contribute in kind. We need help with transportation. We need help in some of our testing sites with other types of logistical support. And so you might be somebody who wants to donate your money or your time, but sometimes it is about the types of services that we really need to actually lower the barriers for access in these populations. And I think all of those are ways we can together actually make sure that we are all protected in our communities.
This beautiful suggestions, very inspiring. I will certainly go look up those organizations. So here's a question from the audience that may relate to equity, but it is a little, I know I'm hearing this question all the time. I'm curious for your perspective. Should companies and organizations require receipt of the vaccine? Should a drug that is an emergency use authorization status versus an FDA approved drug be required? So this is one of the questions that I think everyone's facing as we slowly move towards a new normal. And the way that we answer this question, company by company, organization by organization, has a lot of equity implications, I would think. So how are you thinking about that?
You're absolutely right. I think the common parlance on this is these vaccine passports, right? That you're going to have to show some proof that you have a vaccine, and that from the perspective of an employer, that an employer is going to want to show to actually make sure that everyone is vaccinated. I think it's a challenge right now while we're in the phase of an emergency use authorization, and I don't see that happening. But I do think that these vaccines are going to come into formal approval, and I think that will open the door for some of that. My guess is for institutions like mine, which are healthcare organizations and large educational institutions that bring together large numbers of students at one time, there will be, as there often is in these types of organizations, the requirement with a medical exemption, right? I think the question is what will happen in other types of employers. What will happen in that case? It's very interesting. I heard the data from Israel, which, as many of you will know, has one of the highest vaccination rates. They achieved that high vaccination rate because they, had the logistics on the ground. They were vaccinating quickly and with a good supply of vaccine. But then they also require documentation of vaccine status for a lot of large venues now. So for movie theaters and for other types of venues. And I think that is what I have heard has pushed them to get to those very high rates. And I do think that there is probably going to come a point when we're going to say we could actually open up large venues if we had documentation. And that might be something that a dynamic will play. I love that you brought up the equity issues, because I think the fundamental issue here is how to do those things in an equitable way. And I'll give you an example of the way in which this plays itself out in a challenging way. When we made testing accessible in the Latino community, oftentimes people could not get back to work because they needed documentation of their testing status. And there were lots of rules that people then said, well, you asked me to take time off of work to quarantine and to isolate because of and to get tested, but now I can't get back to work. And I think we have to think about the ways in which we roll these things out equitably so they don't penalize our communities that have been hardest hit by the economic crisis, who are doing the things to protect themselves, their families, their communities, but we don't want to put another barrier in place that somehow is another hurdle that actually prevents them from the types of return to a normal active life that we all want to see. So I think these are the discussions, and with all of them, we have to have equity in the forefront of these discussions.
I could listen to this all day, but unfortunately we only have a few minutes left. I just so appreciate the richness that the nuance that you bring to this, and it's so important. So I'm going to ask you one last question as we wrap up this conversation with a bit of a bow. You talked a lot about what we've learned over the last year. What do you hope changes about how people view equity looking forward? What do you hope changes about what we've learned from this pandemic, assuming we get to the end of the tunnel, we get to equity and vaccine distribution? This won't be the last pandemic we face. What do you hope are the lessons that we learn that we carry forward in our society as a result of what we've seen?
Yeah, I think the pandemic has taught us that interconnectedness, that if I am not thinking about the way in which the person who might deliver my groceries, the way in which the person who might be the security guard where I go to work is actually affected by the pandemic, that it both has an impact on the way we think about the pandemic and may have a direct impact on me personally. That is what a contagious disease tells us. I think crises are also crucibles for innovation. We've seen some fantastic partnerships develop over this time and an acceleration of those partnerships because there's an urgency in crisis. And I think the interconnectedness plus the innovation has led to partnerships that I hope will be sustained into the future. I hope we will maintain some of that collective spirit and recognize that the way we got here is because many of the communities we were talking about have had underinvestment, have had a lack of attention to the very basic needs that are essential for their livelihoods, and that we will carry that forward because each of us is not safe until all of us is safe, and that will be something that will be true in how we recover as well from this pandemic economically and health-wise. And so I'd love to see those partnerships and that collective mindset continue on into the future.
Each of us is not safe until all of us is safe. Those are very important words that we all need to keep in mind as we all hope to return to normal as soon as possible. Thank you. And that brings an end, unfortunately, to this morning's Commonwealth Club program on vaccine equity, underwritten by Salesforce. It's been an honor to join you this morning. I'm Paula Goldman for Salesforce, and this program is now adjourned.